This is section 11 for data evaluation and reporting. This is basically going to talk about how we collect the data from our clients in order to connect them to resources, as well as we evaluate our progress and how we report back to VDA Central Office on what we've been doing down here in the district. For our community assessments, and Portsmouth Health Department has already completed a community assessment. Perhaps we're going to be starting to take that out to community events when we go so we can share some of the statistics. We used a lot of these statistics with many different brochures, infographics, different pamphlets and information that we give out personally in order to share the impact of public health in the Portsmouth area, as well as sharing risk factors, quality of life, mortality, morbidity, community assets and forces of change, also social determinants of health and inequity. What do the community health assessments do? The big thing for us is that it helps in decision making, because it not only helps us to reaffirm the things that we know are going on in our community, but it helps to show it on paper, helps to show it statistically and numerically. It helps us to prioritize health problems so we can see exactly what the problem is and where, and it helps us develop health improvement plans. For individual assessments, basically we're obtaining information from individuals by building a relationship. You're going to assess individuals' needs and their readiness to change, and that's going to be through the intake and planning process. The intake and planning form is a form that you're going to have your clients complete every time you come in contact with them, as well as an encounter form. The encounter form is something for Portsmouth Health Department, and a consent to exchange information form. But the intake form is another big important form that you're going to have them to complete. I'll include an attachment of this in the email for you to see. The intake portion is going to be your name of your patient, demographic information, the date and the type of your visit, because you want to write the site that they were, the site that you first saw them, and also the date, their problem or any risk factors they may be having, their health history, or as much as you can collect in those small areas. The screening tools used, the CDC prediabetes risk assessment and the age-appropriate cancer screening sheet, are two of the biggest documents that we will use, and the name of the referring body, whether it's Bon Secours Health Systems or someone as simple as the small community organization, or maybe the senior center or something like that. We have to let them know where they were referred from. The planning portion of the worksheet is basically to talk about the individual's needs and concerns. This is the portion where you're going to be able to gather as much information as possible. The intake portion is more for the contact information, but the planning portion is more for what exactly we need to do to assist them to get them to resources. So you're going to collect their individual needs and concerns, important facts or updates, if they're going to have surgery coming up, if they have their doctor's appointment, if they're scheduled to lose their insurance or lose their home. That's what we need to know. Any risk factors identified, if they have family history of cancer, family history of diabetes, if they're a smoker, if they have heart disease, things of that nature, things we need to know in order to properly help them. We want to help them to set some goals, because in order to get them into certain resources, we want them to set goals. We want them to set a timeline. That's what we'll help them do. We set a follow-up plan, let them know when we're going to get back in contact with them. Usually it should be no more than 7 days before someone gets in contact with them, because we do have a CHW who does come in every other week and do follow-up, and we also participate in follow-up if there is an urgent need for resources, as well as referrals or linkages provided. As far as documentation skills, we want you to focus on consistency, accuracy, and clarity. With consistency, you want to make sure that all the information that you're including on the form is consistent. If you want to write in their risk factors one word and be very vague and broad, or very vague or very broad with the situation, and then the follow-up you write down a very detailed plan, it's very hard to see how you got that detailed follow-up plan from that vague description. So we need to be consistent with whether we're going to give broad information or whether we're going to hone it down and be very specific. The accuracy, we want to make sure we're getting the right information from our clients, because a lot of times we don't get the right information, we may not know where to refer them or where to even get them to the right resources. We may be sending them somewhere totally different, where that's creating a lapse in time that they need the assistance. Also, clarity. You want to be able to understand what you're saying. So when we do these follow-up forms, we want to make sure we're as clear as possible, even if we have to write out several different sentences or put out several different statements explaining exactly what it is. We want to make sure it's clear so that if anybody was to come look at this, even if they don't know what we're doing, or if it's someone from central office who needs to come and look at this form, they're able to differentiate what the person needs, what the person's risk factors are, and everything like that without anybody having to explain it to them. Medical records and electronic health systems. They may or may not have access to a medical record. That will vary depending on the partnerships. Right now, the CHWs do not have access to any medical records because we are not involved deeply in any health systems or on any sites where electronic health records are going to be used at the moment. You're going to have a history of the patient's health. The history of the patient's health right now that we have is through our intake form. If there does come a point where you have to refer them to certain resources that needs to obtain a history, they will obtain that history, or we can obtain it ourselves if we have a certain form from the organization. Reporting to the supervisors. Whenever you have any problems, concerns, criticisms, or suggestions, feel free to report it to them. It's best to address the situation as soon as this happens. They are there to provide you guidance. If you have any questions or something you're not sure about, if you're not sure where to send a client, the best thing to do is to ask, because the longer we wait in order to get a client into somewhere, it could put them in dire need of resources. And our primary job is to get them exactly to where they need in as less time as possible. All right, that concludes section 11 with data evaluation and reporting.